I'd like to take a moment to introduce Sarah Thiefels. She is a social worker. She's the clinical and macro she's a social worker for the clinical and macro program for general caregiver support services. She's a coordinator. She works out of the John D. Dingle Detroit VA Medical Center, and she's an expert in the VA programs for caregiver support. So without further ado, I would love to introduce Sarah.
Hi, good afternoon, everyone. Thank you for letting me come here today to speak about our VA caregiver support program. So the mission of our program is to really promote the health and well-being of family caregivers who care for our nation's veterans, and through our education, resources, support, and variety of services. Just to kind of get an idea of who are our veteran caregivers. So 5.5 million military caregivers, 1.1 are for our post 9/11 veterans. 12% spend more than 40 hours per week providing care, and it's worth nearly $3 billion in that unpaid care that they provide. And 79% of caregivers of veterans have polytrauma are women. So the VA Caregiver Support Program, it consists of two subset programs: our Program for Comprehensive Assistance for Family Caregivers and Program for General Caregiver Support Services. So first we'll discuss our VA's comprehensive program. So this program provides enhanced services to eligible family caregivers, including a monthly stipend, counseling and mental health services, respite care, education, training, resources, and certain beneficiary travel benefits. Some caregivers may be eligible for health care through the Civilian Health and Medical Program of the VA, also known as CHAMP VA. Once a caregiver is enrolled in the comprehensive program, wellness contacts are wellness contacts and annual reassessments are completed. The caregiver support program will require to complete a wellness contact with the veteran and the caregiver at least every 120 days, with at least one occurring in the veteran's home. Veteran and family caregivers are required to participate in these wellness contacts. And during this time, the caregiver support coordinator assesses the veteran and family caregiver's well-being and the quality of personal care services being provided by the caregiver. The caregiver support program, we're also required to conduct periodic evaluations of the caregiver skills and the eligible veterans' needs. So this helps to ensure that they have the necessary skills, knowledge, and resources for the veteran to continue progressing towards improved health, wellness, and independence, such as when such potential exists. Reassessments are conducted on an annual basis, as the veteran's personal care needs may change over time, as may the needs and capabilities of the caregiver. So the reassessment will also assess the level of needs if they've sustained, increased, or decreased during that year. So for veteran eligibility, so the Program for Comprehensive Assistance for Family Caregivers currently supports family caregivers of eligible veterans who have at least a 70% service-connected serious injury that was incurred or aggravated in the line of duty on or before May 7th, 1975, or on or after September 11th, 2001. So just in case you're not too familiar with the VA system, a service-connected serious injury means that the veteran is disabled due to injury or illness that was caused or aggravated by their military service, and it's rated as a percentage. So the next big piece of veteran eligibility for this program is that they must be unable to self-sustain in the community. So this can be met in two ways. So the first way is to have this inability to perform an activity of daily living, meaning the veteran must require personal care services each time he or she completes one or more of these activities of daily living. So this could include help with bathing, dressing, grooming, adjusting a prosthetic, toileting, feeding, and mobility. So for example, as the caregiver, you help the veteran maybe wash their back because of a shoulder injury. So to be eligible, the caregiver needs to help the veteran with this task every time they take a shower. So if the caregiver says, oh, I help them, sometimes wash his back when, his shoulder's hurting. So then the caregiver would not quite meet that criteria under this section because it's not every time. The second way to meet this criteria of being unable to self-sustain in the community is to have this need for supervision, protection, or instruction. So meaning the veteran must have a functional impairment that directly impacts their ability to maintain their personal safety on a daily basis. So for example, because of the veteran's dementia, you have to supervise them every time they take a shower in order to guide them through the steps and provide direction. Without your guidance as the caregiver and oversight, they would not be able to successfully wash and clean themselves and maintain their safety in the bathroom. Other eligibility criteria is it has to be in the best interest for the veteran and caregiver to participate in the program. The personal care services can only be provided by the identified caregiver in the application. They have to receive this personal care in the home, and then also having ongoing care from a primary care team at the VA. You will get a pretty extensive eligibility criteria fact sheet in that email afterward that lists all of these points and details everything as well. So don't worry if you don't quite remember or if it's a lot of information. So you'll have these fact sheets available to you. So under the Mission Act of 2018, so this law expanded eligibility for the comprehensive program to veterans of all eras in these two phases. So phase one took place this past October 2020. So veterans who were seriously injured in the line of duty on or before May 7th, 1975 became eligible. So this added in our World War II, Korea, and Vietnam veterans. And our phase two is when that gap is filled. So by adding in veterans who were injured in the line of duty between that May 7th date and September 11th, 2001. So then this adds in our Gulf War veterans. So, and this is estimated to take effect in October 2022. A veteran can identify a primary and, if applicable, up to 2 secondary caregivers. And the eligibility for these caregivers they have to be 18 years or older. And to be a family caregiver, you must be an eligible veteran's spouse, daughter, son, parent, step family member, extended family member, or someone who lives with the veteran full time. So to clarify, so if you are not an immediate or extended family member, you would be required to live with the veteran full time to be eligible for the program, or be willing to do so if designated as that family caregiver. And then both the identified primary and secondary caregivers, they'll be assessed by the caregiver support coordinator, and they have to complete all of the required caregiver training during the application process. In addition, there also must be no determination by the VA of abuse or neglect of the eligible veteran by the caregiver. So there are 3 ways to apply for this program, for the comprehensive program. The veteran and caregiver, they can visit the caregiver website and fill out the, it's called a 1010 CG is the name of the form. They can fill it out online and submit it electronically. That would be the fastest way of getting that application to us. You can also download the application and mail it into the Eligibility Center. And you can also apply in person. You can come to our social work office here at the Detroit VA, red floor, red section, first floor between 8 and 4, and you can meet with one of our caregiver support coordinators. You have that option to complete the application there or take it home to finish later. So this is what the 1010 CG application looks like. It's important that every field under the veteran section and the primary family caregiver section are filled out accurately and completely. So the veteran is not required to put down a secondary caregiver. The secondary caregivers are not financially compensated if eligible, and only the primary caregiver would receive the financial stipend. It's also important that we have the caregiver's full legal name, full social security number, complete address, and date of birth on the applications. If they're not an immediate or extended family member, the addresses for the veteran and caregiver must match because of that requirement that a non-family member must live with the veteran or do so if approved. So here is the flow map of the application process of kind of what happens once we receive the application to that final determination. So once we receive your application, the veteran and caregiver are assigned to a social worker that guides you through this process. So you're by no means alone in this process. The application intake with the veteran and caregiver is completed virtually or over the phone. They review the 1010 CG application, and then they screen for eligibility at this administrative level, making sure that the veteran meets the 70% service connection or more, and then also make sure that their military service is within the current eligible date ranges. If they don't meet criteria, the veteran would not be eligible for the comprehensive program, and the caregiver and veteran would be referred to our general caregiver support program, where they can still access all of the education, training, and support that we offer. So we'll discuss the general caregiver program next. If the veteran and at least one caregiver applicant meet that specific eligibility requirement, they move on to the next step. So there are 3 assessments that are completed. A veteran assessment where clinical information about the veteran is collected, including the caregiver's input on the veteran's care needs. A caregiver assessment is completed with each caregiver applicant, and a veteran functional assessment where a registered nurse clinical assessor looks at the veteran's functional care needs. So once all 3 assessments are completed with the veteran and caregivers, the application is sent for this initial review. And our centralized eligibility and appeals team, which is at our regional level, they conduct a comprehensive review of the veteran, caregiver, and functional assessments completed by us at the local level. And then they also look at the veteran's internal medical records and any medical records that were scanned into their chart from outside providers, if applicable. If denied at this initial review stage, the veteran caregiver again are referred to the general caregiver support program. And if they're initially approved, they will continue through the next few steps. So the next part is that each family caregiver applicant completes caregiver training online, and then our registered nurse would conduct a home care assessment with the veteran and each caregiver to determine the well-being of the veteran and caregiver, as well as the competence of the caregiver to provide personal care services in the home. So once they've completed the training and the home assessment, The application as a whole goes back to this centralized eligibility and appeals team, our SEAT team, for this final determination. And then lastly, within 90 days of the application being received by the VA, the veteran and caregiver will be notified of the determination. So if a caregiver and veteran are denied for the comprehensive program, either at that initial stage or that final determination stage, they have the right to appeal that decision. And the caregiver and veteran in writing request an appeal and provide any additional information to the patient advocate's office. And there are several levels of appeals. So this process, it has many steps, and it goes back and forth between the local and regional offices. But like I said before, you are assigned a social worker that helps you through every stage, that guides you through what is needed and when it's needed. And all of these steps are outlined in detail in the application process fact sheet, which you will also get today after the presentation to have and review more thoroughly. So next I'll talk about the General Caregiver Support Program. So our General Caregiver Support Services provides education, training, and support services to eligible caregivers of veterans. So to participate in the program, you need to provide at least one personal care service to veterans that are currently enrolled in the VA healthcare system. There's no service connection rating required. And then when the veteran served is not a factor in eligibility. So that's the important distinction between the comprehensive program, which has that 70% service connected requirement, and then when the veteran served does matter. So how you would apply, there's no formal application. You would just contact the Caregiver Support Program, express your interest, and then they would direct you to myself to enroll in that program or to talk about it further. So once enrolled in either the general or the comprehensive program, caregivers have access to several different types of education and training. So our REACH program, which stands for Resources for Enhancing All Caregivers' Health, provides education, a focus on safety for the patient, support for the caregiver, and skill building to help caregivers manage difficult patient issues and then decrease their own stress. So it's available to caregivers, and it focuses on specific diagnoses. So dementia, post-traumatic stress disorder, ALS, MS, and spinal cord injuries or disorders. It is also available to veterans based on era of service. So veterans of all eras, and then also a program for spouses for post 9/11 veterans. Caregivers First, which stands for Finding Important Resources, Support, and Training. It's designed to help improve the veteran's experience of VA care, reduce your feelings of isolation, learn how to help the veteran remain independent, provides you with skills and resources to help your veteran at home, improve communication, plan for the future. You learn about depression and avoiding caregiver burnout. So it has a wide variety of topics that's covered in this 4-week class. The VA SAVE training, it provides educations to caregivers about suicide prevention, mental health, and substance use disorder treatment. It helps the caregiver to be able to recognize signs of suicide, be better able to ask their loved one about suicide. They're taught how to validate feelings and emotions, and then how to encourage and expedite treatment. The Caregiver Support Program offers peer-led caregiver support group that provides a forum for caregivers to meet and exchange ideas, socialize, share resources, offer support, learn to manage stress and anxiety. There's an emphasis on the caregiver taking care of themselves by staying engaged with peers, requesting help, and then utilizing services available to them. There are 5 self-care courses that are offered by the VA Caregiver Center through the Memphis VA on handling emotions, lowering stress, improving mood, managing stress, problem solving, and then effective communication. So they come as requested and then put on these different presentations for our caregivers. Other programs for caregivers that are offered through the Detroit VA. So Warrior to Soulmate is offered through the chaplain services here at the Detroit VA. And it's an evidence-based therapy to rapidly enhance wellness by strengthening a veteran's relationship with significant others. And then Strength at Home, which is offered through the Intimate Partner Violence Program at most VAs, is a 12-week group intervention program for veterans who use or who are at risk of using any form of intimate partner violence. So there's also some other trainings that are offered at our national level for caregivers of veterans that are both in the comprehensive and general program. So Building Better Caregivers is an online workshop for caregivers who are caring for someone with dementia, memory problems, PTSD, traumatic brain injury, or other serious injury or illness. It helps caregivers in 2 key ways. It offers training in how to provide better care, and it also helps caregivers learn how to manage their own emotions, stress, and physical health. The VA Annie Caregiver Text Program, it's a text messaging-based service that promotes self-care for managing day-to-day stress. So Annie, it's a computer system that sends the caregiver a personalized text message that provides information to help them manage their well-being and provide care for their veteran. There are group educational calls that are offered monthly by the caregiver support line. During the call, caregivers can discuss self-care tips, ask questions on a variety of topics. Past presentations are always available to anyone on the caregiver support webpage. There's also a Spanish-speaking telephone caregiver support group call as well monthly. The Caregiver Peer Mentoring Program was developed to strengthen relationships between caregivers, to provide an opportunity for networking, and to empower caregivers to help one another. The program provides an opportunity for caregivers to receive guidance, to share their experience, their wisdom, skills, and passion with other caregivers. There's also a suicide prevention toolkit for caregivers available on the website for anyone to download. And then lastly, there's also a wide variety of self-guided materials that are on the Tips and Tools webpage under the caregiver website. There are several other larger special events that the VA Caregiver Support Program puts on each year. National Family Caregiver Month is in full swing. It's in November. And we're having a lot of different special events throughout the month. One in particular on November 19th. It's open to all caregivers of veterans, regardless of if you're enrolled in a program or not. If you're a caregiver of a veteran, you're welcome to register for this event. The annual Family Caregiver Resource Fair is done mostly in the spring, early summer. This event features community caregiver support programs, other resources that caregivers utilize in the Metro Detroit areas. Last spring, we had over 18 organizations speaking about their programs and services. The annual Caregiver Summit is directed towards our VA and community partners. This year's theme is suicide prevention, care for caregivers and veterans. And then the Caregiver Support Program publishes a monthly newsletter that provides this well-rounded look of upcoming events, education, training, and support, as well as updates to the program. The Caregiver Support Line is staffed by VA clinical social workers who respond to calls from caregivers, veterans, and community agencies that are seeking information about VA caregiver services. Social workers, they provide information about assistance through the VA. They offer supportive counseling, and then link callers to their local caregiver support coordinator. So if you were to call the caregiver support line, we would receive a referral at our local level, and then we would reach out to you. Our Detroit caregiver support program, we have a centralized line that you can contact. If you have questions, concerns about either program, need help with finding resources in the community, getting connected to other programs, the Detroit VA, we maintain close relationships with our community partners just for that reason, so that we can help connect you to all the services that you are eligible to partake in. And our newsletter always includes events from our community partners and what they're doing as well. So if you ever need to reach out for any reason, you can give us a call at our centralized line. So that is both of our programs, the comprehensive and general programs, and then just kind of opening it up for questions if any of you have some.
Thank you so much, Sarah. We really appreciate you and your expertise and clarifying the different programs that you guys have available. You can either unmute yourself to ask a question or raise your hand to ask a question, or put it in the chat box. For those of you that are calling in on the phone and you're on mute and you would like to ask a question, you can unmute yourself on the phone by pressing *6, and that will unmute you on the phone. Anybody have any questions?
I have a question, Sarah. This is Brenda, and I'm wondering, you mentioned the newsletter. Is there a way to be added to like an email distribution list to receive the newsletter regularly?
Yes. If it would just be letting me know that that's something that you'd like to receive each month, and I can put you on a list for anyone either in the community or not yet enrolled in the program. We can get that out to you each month as well.
So if I put my email address in the chat box, would you be able to pull it from there?
Yes, yep, I would definitely.
Okay, great, thank you.
And Sarah, would it be okay when I send out the Survey Monkey for after the session along with your handouts, if I put your email in the body of the Survey Monkey so people could email you afterwards as well?
Yes, yep, you can put my email, reach out to me by email. You can call the centralized line. Yes, that would definitely be okay.
Thank you so much. Are there any additional questions?
There is a question in the chat.
Yep.
Okay.
Yep.
I'll read it for those on the phone, and then the question is there a way to help a spouse of a veteran verify if the deceased veteran's spouse served during wartime? And when the surviving spouse has dementia and the children cannot find the paperwork. So is there a way to help the spouse verify if the veteran who's died served during wartime? How do family members get that information?
So, so when a veteran is discharged from the military, they are given a form called a DD-214 is the name of the form. And this form details all of their service, the dates, medals, everything you would need on that discharge. So that is the form you would need in order to know what dates that the deceased veteran served and that would tell you if they served during wartime. So to access this document as a spouse or a family member, you would need to, you can go through the National Archives in order to request military records, is where you would go. Is one way to access that document.
Thank you.
Is this
Sarah,
something
I
that,
think you just confirmed something, and that is the definition of a veteran. You mentioned serving during wartime, and maybe that's relevant to some listening, whether or not someone who's been in the military is eligible, or only if they served during wartime.
See that question again?
It seems that you mentioned something about eligibility in wartime, serving during wartime. If someone has been in the service and they have something going on related to that, maybe a mental can't give it up kind of thing, if they were not serving during wartime or active during wartime, are they still eligible for some services?
For the caregiver support program, they would have to have served within a specific time frame. So right now, it's that on or before May 7th, 1975, or on or after September 11th, 2001. For the VA as a whole, it depends on the program. Some programs require a certain level of service connection to be eligible. Some programs are only support veterans.
oh, Sarah, you just froze up for a minute. Uh-oh. I apologize. We may have just lost Sarah for a moment.
Okay, can you hear
There
me?
she is. Yes.
Okay, sorry about that. So some programs require that they have served during wartime, or so if you're a peacetime veteran, you might not be eligible for certain programs or services. So it really depends on what programs you're looking for. So for the caregiver program, we require that you just have served during any time during those dates, before May 7th, 1975, or after September 11th. So and then in October 2022 is when kind of like that middle gap is filled. So so it does depend on what services you're looking for at the VA if a veteran is eligible for that. So everyone has very different criteria. Does that kind of answer your question? To know if the federal benefits booklet for veterans, dependents, and outlays all of the different eligibility criteria, and also lists, what are the definitions, like when are the dates of wartime. So when does our country define these dates of wartime, so that you can know, like, oh, if my husband or daughter served during this time period, that it matches up with the dates that the federal government recognizes as wartime or peacetime service.
Thank you, Sarah. I just put in the chat to everybody. I found the website that has information on how to get a DD 214 of a deceased veteran and the documents that you have to obtain that.
Looks like Brenda has her hand raised.
my question from before, I will lower it. I always forget to lower my hand.
Thank you.
I was
And
just
then-
asking about being added to the newsletter.
Okay. And then I saw that John also posted a website on health benefits. That's helpful as well in the chat for anybody. Are there any additional questions? All right, well, if there's no additional questions.
There's a question in the chat.
Oh,
There is one more. Yeah, there's one more question.
Oh, okay, hi, Jesse. Long time no see. And this is from Jesse. All or most of the benefits only eligible to vets or retirees who have a service-related disability? That's the question.
I would say that a lot of the programs and services do require some level, but when you're looking at primary care, specialties, medical equipment, there's a lot of things that service connection has nothing to do with, or does not affect the eligibility. There are certain programs in medical social work that provide care in the home, or respite care, or home health aid. A lot of these don't have a service connection requirement. But if you're looking, so a lot of programs do require, like a lot of the VA nursing homes, like in-house nursing homes, have limited space, so they require a higher service connection in order to be eligible. So when you're looking at, and that's what makes it difficult, is each program, each service has their own requirements and eligibility, because of a lot of the programs are dictated by how much money is allocated to each department. Our program, the caregiver support program, was able to expand, because of this Mission Act, in 2018. So our program, for our caregivers was expanded because of the importance of it. So because of that, we're able to reach a larger area and include a lot more, a great deal more of our veterans and then eventually it won't matter when you served. So things like that do kind of dictate eligibility, the size of the program and the funding, because it is a federal institution as opposed to like a private hospital system or like a nonprofit. So it's a little bit different. So if you have a program in mind or a service, you can always, every primary care team has a social worker that you can reach out to say, I need this service. How do I get access to it? What's the requirement? You can always talk with a Veterans Benefit Administration. So talk with a service organization to see if you can increase the service connection percentage that's in place, or to apply for service connection to see if the veteran is eligible for service connection. So there are ways to increase like your eligibility in certain programs.
Thank you, Sarah. And there's a
Yeah.
comment that in the chat, just for those of you on the phone, that there is a way to assist troops in obtaining benefits for services not associated with military caused issues. And you would need to contact their VA representative to obtain what is available. So reiterating what Sarah has just spoken about.
There's also a question in there about, so once the veteran is approved, how long before services begin? So, so for the caregiver program, for the comprehensive program, once you go through that kind of lengthy application process, that 90-day process, and you get your determination that you've been approved, we make sure the application and everything is correct, and then we submit it to our Office of Community Care, and they are in charge of getting the direct deposit set up and everything, all of the logistics set up. But the one thing to note is that, so the comprehensive has this financial stipend, and that is as an extra benefit. Just like with Service Connection, the date you apply for the program is the date that that we look at when we. So if you're approved, you are back. Everything is backdated to that initial application date. So you would receive kind of like a backdated. What's the term? You would receive, so if it took 3 months for that application to process, your services would start, and you would get those 3 months that you were waiting through that process in that monthly stipend. So you would get that back pay from the start of that application process. So services we would get you set up right away, and then you would be compensated for that time. So if it took, if our centralized eligibility team was kind of delayed in reviewing an application, and it took maybe 4 or 5 months to get a determination, you would get that back pay from that the initial that valid application date from when you applied. So so yes, services start right away. The other thing, as far as like the education, training, and support that we offer, from the day that you apply, you are eligible for that, for our special events, for our classes. You know, so if your application's in process, you can participate in our programming. So you don't have to wait, because if you need that support, you know, right away when you apply, you know, it would be difficult to have to wait until you hear back from your application 3-4 months later. So you can start with those services right away. And with the general program, you know, because there's no application, and there's just very minimal eligibility requirement, you know, it's just we do 2 assessments with you, and then you're enrolled in the program. So you have access to those services right away.
Thank you, Sarah, for clarifying. We appreciate that. I don't see, oh, go ahead.
One other thing to mention is that so our program, it currently supports so caregivers of veterans. Right now, if you're a veteran caregiver of a non-veteran, so if you're a veteran taking care of your spouse who's a civilian, who's not a veteran, you wouldn't be eligible for the program. We provide resources and referrals to our community partners. So like we would refer you to Henry Ford. So right now the program, if you're a veteran caregiver of a non-veteran, we're not able to provide services. The one thing that we can provide is our caregiver center, the National Caregiver Center based out of our Memphis VA is able to provide our REACH program to our veteran caregivers of non-veterans. They are able to do that program with you one-on-one or in a group format. So we do offer that REACH program to our caregivers of non-veterans, but for the most part, we would refer out for that.
Thank you. Thank you for that. So it's 12:53, and so we like to end 5 minutes early. So we do have time for just one more question, if anybody has any questions. And I don't see any in the chat. So Sarah, we want to thank you again on behalf of I Care for You and Henry Ford for Vets for doing this for us. And we'll be sending out a SurveyMonkey after the session, along with the documents Sarah reviewed and also her presentation. So we appreciate y'all calling in and being here, and hope you have a great week. Thanks so much.
Hey, everyone. Take care.
Everyone. Bye.
Thank you. Bye.